one, and the human body does not change appreciably all the time you've been on planet Earth here, okay? So, that's what we want to do. Now, let's talk about, and again, calcium, we're going to talk about here, the best kinds. Your calcium carbonate, you might as well go out and get the sidewalk and crush it up into powder and take it. That's what it is. What you want is the calcium lactate form. This is the most absorbable, but it's hard to find. It's what we carry here primarily. Citrate is another good one. It's not as good as lactate, but it's not a bad second. You can find citrate very easily. Calcium citrate is pretty easy. But the calcium carbonate, it's just chalk. That's what they put in Tums. They put it in there to neutralize the acid in your stomach, which is really stupid. That's a whole other lecture. You want to shut off your digestion. And if you've got problems, it's because you're usually not making enough acid, not even making too much, but that's a whole other issue. So you don't want to take calcium carbonate, and you don't want a supplement that includes it in it because it shuts down your digestion. So citrate or lactate, the only two we use. Lactate is not made from dairy. It sounds like lactose. It's made from beets. It's a lactate form, lactic acid form of calcium, extremely absorbable. Now, I only know of one or two companies that even provide this stuff in this country. Standard Process is one small business. But I've never seen it in health food stores. But the citrate you can get, and it's not that, okay? So let's talk about options. What do? Diet. Let's say you really get sick. You've already got the bug. You've been trying to do what's right, but you got sick anyway. You picked up the flu, or you got a cold, or whatever it is. Antibiotics don't work on viruses, people. Okay? There's not much point in taking them. They just are toxic, and they're just going to give your body a bad time. If you happen to have strep or staph, they can help with those, but oftentimes they don't even work that well for those things because these different strains are getting more antibiotic resistant because we have them in our food and our meat and our milk, and the bacteria aren't stupid. Some of them survive and they reproduce. They become resistant. It's a real problem with the medical community to try to keep ahead of the bacteria so we don't get these super infections. We're starting to see them more and more because we've created superbugs using so many antibiotics in our food supply. So what you want to do is if they did some studies, and this is a whole other lecture, but I was going to recap before you real quick. They found that when people come with massive infections in the hospitals, they have very low vitamin C levels in their blood, extremely low, and calcium. And so what they do is they start giving them IVs of calcium gluconate, calcium lactate, and maybe some ascorbic acid. Boy, a lot of people turned around. Now that was using lousy ascorbic acid. You know how that's made? It's basically hydrochloric acid and corn syrup. That's how they make it. Structurally, it's the same as regular vitamin C, but it doesn't have the additional things. Now, if you gave somebody an IV of natural vitamin C as a food source, you kill them. Cause coagulation of the blood. So in that case, we want to use synthetic. Sodium ascorbate, calcium ascorbate, something like that. You want it to be a drug-like effect, but it can knock out infection. Back in the old days, before you could get antibiotics of any kind, one of the things they used was, if you got diphtheria, or you had an infection, give you lemon juice and calcium. Generally knock it right out. Okay? Back before then, they also used diluted hydrochloric acid IV push. It's one of the things we're going to be using here real soon. And any infection, I know of cases of full-blown hepatitis knocked out in a matter of days using a mixture of ascorbates and diluted hydrochloric acid, because hydrochloric acid, highly diluted, stimulates white cell activity, so it cures. That's one of the things we'll have here available. As soon as you get sick, when I get over it, come in, give you an IV push of this little cocktail. One or two of them in business. Okay, so that's an option that you'll have. You come down with the swine flu, don't panic. Okay, only get an IV push. So that's one of the things. Big thing, chicken soup. Believe it or not, they've done studies. It actually does work in helping to knock out infection. I have no idea why, but it does. So real, honest to goodness chicken soup. Hopefully you're going to use organic chickens, not the ones that are loaded with antibiotics. And also green drinks, again, alkalization. To make yourself green smoothies, or what we have in our family called green drink. We take parsley, put a big bunch of it in the blender, a tray of ice cubes, and half a can to a can of pineapple juice. It's hard to get the fresh stuff. So we have to use the can. You blend that up really good, and my kids fight over it. It's called green drink, not that. Yeah, parsley is actually very, very tasty. Don't worry about screaming out the parsley.
So you have to use wheatgrass, right?
You could use wheatgrass, but that's pretty potent.
Yeah.
And you could use that. Again, green stuff. If you have a juicer, you got wheatgrass, use it. Anything green will alkalize you, knocks out the bugs. Okay? They don't like an alkaline environment. They can't thrive in that. Okay?
What about cilantro?
Cilantro's fine. If you try, cilantro depends what you want to use it for. If you use cilantro,
Well, I mean,
pull out
put it in
hip.
the green room.
You could. It's just that if you don't mind the taste. It's
Oh, I
fine.
love cilantro.
If you like cilantro blended up with the green bean, more power to you. Some folks find it a little bit heavy in the flavor, but if your taste buds are happy with it, absolutely, it's green. And it's got chlorophyll in it, it's just fine. Kale, we have a whole sheet of recipes. I'm giving most of you here. They're these green smoothies. And they're delicious, absolutely delicious. They've all been kid tested.
I was using a lot of parsley, and then I read something recently. I was afraid to use it because it said that, number one, it's a strong diuretic, and number two, it can be toxic in large quantities.
He doesn't get an awful lot.
That's what I would think.
And it is a diuretic. It's also very good for adrenals.
Okay.
Those of you that are adrenal type with our weight loss, what's the tea that we recommend? Parsley tea. It's good for you. It's good for adrenals, but it's also it's a diuretic and a cleanser. And it alkalizes very nicely.
I put a lot of mint here. I've been making
Mint's
mint tea
great.
for the summer.
Yeah, mint's great too. But again, when we're using the smoothies, we want it all raw. Now,
Yeah, it's
cilantro is a really good
raw.
mercury chelator, but you have to heat it up. It's better if you make it into a soup than if you eat it raw to pull out mercury out of your system. It's very, very effective for that. Okay? Yeah, what do we got here? Okay, let's talk about vitamin D therapy. This is very recent research that's been done on vitamin D therapy. This is if the only thing I've got here is if you've got the bug and you want to get rid of it. You take 2,000 international units per kilogram of body weight, and the formula is down there. You take your body weight, let's say you weigh 100 pounds, times 0.45 times 2,000 tells you how many international units you need. It's a lot. And to do that for only 3 days, we don't want you to get toxic on the D. But the D helps to mobilize calcium, also has a very powerful effect on the immune system in and of itself. And then you drop it down to 5,000 units a day, which is the maintenance dose. But that's one way to get rid of the flu. And a number of medical doctors are using this now. The other one is you can go ahead and get some calcium lactate or citrate. I put down there second best on the citrate, fresh lime or lemon juice or whole food vitamin C. And you go ahead and you take that every 30 minutes to an hour. It'll help you knock out infections too. And if you did an IV push, we would use the synthetics. That's okay because you want a drug effect. We would also be giving you the oral stuff, the natural form. Okay? But that's a good way to knock out the flu. Vitamin D, calcium, and also the vitamin C in a whole form. Another one we'll sometimes use is what we call vitamin F, which is essential fatty acids. That helps to get the calcium out of the blood into the tissue. So we could use flax oil, something along that line to help deal with that. Okay? So those things can help knock out infections if you feel like you're getting them. Now we have products here that some of you are familiar with that I tell everyone to keep in your house. We use Imuplex or Conjuplex. And I say keep a bottle around. The first inkling that you're getting sick, start taking, cut out the sugar, and start taking 2-3 times a day. Generally will abort any kind of infection before it ever gets going. Okay. Usually with most people. Sometimes it doesn't because your immune system's too weak. And you have to continue taking it. I've had people come in and been on antibiotics off and on for months. We put them on Imuplex and it knocks them out in a matter of 2-3-4 weeks. And when we get the IV push and the IV drips, we'll be able to do it even faster. Okay? Infusion therapy, that's the last one that I've been mentioning to you. The nutrition cocktail with hydrochloric acid.